So another thing that you always emphasize on is early diagnosis. Why early diagnosis is so much important? I want to elaborate that question a little more. Like an elderly at age of 60 who has just started knee pain, if comes to you, versus who has just lived with that pain for 10, 15 years and has come to you at 75. What are the changes or approaches in his treatment or her treatment you would do as a clinician?
That's a great question. I think when we talk about early diagnosis, what we are talking about is recognizing the condition early, putting a label to the cause of the pain, what we call as diagnosis, and more importantly, once we label it, then starting the treatment. So early diagnosis is completely equal to early treatment. So why I say early diagnosis is important? Because most of the causes of knee pain, which if picked up early, either can be treated completely or can be treated to a large extent where they don't disable the patient or don't force them to surgery. And number three, at least if there is some major problem in the knee which can lead to a larger issue later. For example, there may be a small tumor, there may be a small growth, there may be a fracture, there may be a loose body. So if you pick up those conditions early enough, they can be treated very effectively so as to make the patient normal. Versus, if the patient doesn't come to you, there is no diagnosis made, then the patient lives with that condition. If there is a torn meniscus, if there is a loose body, if there is some kind of growth, and then the patient says, no, I am okay, I am getting some pain, I am taking some painkillers, I am managing, and the patient comes to you after 6 months, 1 year, then essentially what you could have done to salvage the joint, you cannot do, because in that period of 6 months, 1 year, we have missed the boat of making the patient completely all right, because he has developed certain degenerative changes which are not reversible. And that is why early diagnosis is important, because as we say, a stitch in time saves 9. So early diagnosis will prevent the further deterioration and the complications which can happen if the patient neglects his knee, doesn't go to the doctor early, and tries to treat himself for a longer duration with the hope that it will get better. But friends, that's not the truth. The truth is you will degenerate your joint more and make it more difficult for the doctor to treat you if you go to him late.
Thank you so much, sir.